Okay, this is a great question. So this is something I want to address. Two things actually I want to talk to you guys about. Number one, you're going to give the patient hydration before you give them pain meds. Absolutely, because at the end of the day, whenever you're trying to figure out, what your priority is going to be, always go back to Maslow's hierarchy of needs. Always go back to physiological integrity. What keeps that patient alive the longest? Vital signs, hemodynamic status, ABC, all of that good stuff, glucose, nutrition, all that good stuff, right? So you're going to hydrate the patient first. That's number one. Number two, when it comes to sickle cell disease, sickle cell crisis, I tell my students, pain never killed anyone. Pain is never a priority except in certain situations. What are those situations or circumstances? It is cancer. It is stones, gallbladder stones, kidney stones. It is, what's the third one? MI, myocardial infarction, and there's a fourth one, burns. In those four situations, pain is a priority. But even though pain is a priority, if you have to choose between pain medication and hydration for that sickle cell patient, you're still going to choose hydration. And the reason why is, again, you have to think about what's going to kill your patient the fastest and what's going to keep them alive the longest. So even though pain medication is a priority, you giving that patient hydration is going to turn those sickle cells back into disc cells, which is going to increase and promote the movement of blood through their system. Guess what? Doing that alone is going to decrease the patient's pain. So you're going to do that first. You're going to hydrate that patient. Then you're going to address the pain. But let me be clear about this. Pain absolutely is a priority in the patient with sickle cell. Pain is going to be a priority in the sickle cell patient, and the patient with burns, and the patient with cancer, and the patient with stones. I hope this was helpful.